today I have Dr. Trevor Kouritzin. Congratulations. He recently completed his PhD from the University of Alberta, and he specializes in preventative medicine. His groundbreaking thesis, titled "The Effective of the Neighborhood Food Environment on Self-Reported Food Intake and Food Selection," it explores the crucial role our surroundings play in shaping our dietary habits and overall health. Trevor, thank you for being here and being willing to share all your amazing research. I mean, this is years in the making, right?
Yeah, 14 years. I feel old saying that now.
Only 14. So I would imagine this must be some sort of a passion project for you, because it goes into depth. And what really started you down the medical path? Let's start there.
Well, if we go way, way back when, I was 18 and so people are like, what do you want to do for the rest of your life, right? I
Yeah.
was quite into bodybuilding, lifting weights. My answer was work out and eat chicken breast, was probably like, what I wanted to do when I was 18.
Lift
Now,
weights and eat chicken.
right? So like I've always been passionate about working out and lifting weights and things like that. And then my dad, being a professor, was like, that's stupid. You need a plan B, right? Like, if you are going to be a personal trainer or things like that, like that's not a career. So I did chemical engineering under the advice of my dad as kind of like a plan B and a safe degree to have, right? Like with engineering, you can really do anything. And that's where I really learned about chemistry and molecules. And I found it fascinating about how structurally, like a protein and a carbohydrate and a fat are all different and things like that. And then from there, I finally went on into nutrition and did a master's in nutrition, something I was actually passionate about. I loved it. I loved learning about all the individual nuances about nutrition, how much protein we should eat, how much essential fats we should eat, vitamins and minerals, all that type of stuff. But I still remember at the end of my master's, I almost felt kind of like cheated, because after a 4.5 year master's degree, there was no talk about the accessibility of food, the affordability of food, and the availability of food. And I almost felt like the master's degree was almost this like fairy tale where it's talking about all the health benefits of fruits and vegetables and lean proteins. But when I would tell people about this and, tell people at church and colleagues and, things about what I'm learning, they're like, well, I can't afford that. Or, oh, I don't know how to cook that, right? Like, I kind of felt cheated that in a perfect world, this would work. But there's a lot more to food than just the actual knowledge about food. And that's where my doctorate came into play. It was in preventative medicine. And that really took a look at almost the emotional or the environmental or the public health aspect of food, right? We People know what's healthy and what's not, right? Like most
Well,
people
kind
aren't.
of, right? So everybody has a little bit of health in what they receive. So you grew up a certain way. So whatever you learned to be normal for your healthy, right? And I know people who eat processed food, and to them that's healthy. They don't know any different. So I think maybe touch on what it means to be nutritional healthy, because that might be a good basis to set a standard for people listening. Like, what is healthy and being nutritionally sound mean?
The simplest answer to that is don't eat processed foods. If God made it, eat it. If it comes in a box with a bunch of ingredients you can't pronounce, don't eat it.
Okay, well,
If you
that's easy
really
enough.
start to look at when our health declined as a society, it was after the Second World War when we started eating processed foods. And you can get into the individual nuances of like what fruit is the healthiest fruit and what vegetable is the healthiest vegetable. But if you're eating unadulterated proteins, unadulterated grains, fruits, vegetables, minimally processed dairy, like really the Mediterranean diet, that's the healthiest diet because it's natural, right? Like it's food as it should be. You're eating food as it's grown, you're eating food that's not adulterated. That's the healthiest diet. Now, that said, that's not the easiest diet to eat because it requires cooking, it requires high cost. Most of those ingredients are perishable. So, it's not something that you can purchase in bulk, and right. So like there is a skill, an opportunity, and a motivation component to that. But I would argue most people have a general sense of what's healthy and what's not healthy. Food nutrition companies do trick people. Like, people think granola bars are healthy where they're not, right?
Yeah.
But like most people aren't eating a Big Mac and fries thinking it's healthy. And most people, if they see, like roasted vegetables and grilled chicken breast, like they know that'd be a healthier option. The nuances about seed oils and things like that we can get into, but I would argue most people have a general sense of what's healthy and what's not healthy.
So in your when you were going in to go for your PhD, you said there was different levels of medicine. Can you expand on that?
So remember in that Shrek movie when Shrek says ogres have layers?
Yes.
Onions have layers. So
Yes.
onions have layers,
Yes.
ogres have layers, and medicine has layers. And
Okay.
this is stuff I didn't really fully understand until I actually went into medicine. When most people think medicine, they think tertiary medicine, which is, a surgeon performing a triple bypass surgery on someone having a heart attack, right? And
Right.
that I think is kind of like the sexiest form of medicine, right? Like when people think about cool medicine, they think about like surgeons, the ER room, like, emergency tertiary medicine. After that is secondary care, which is screening. That would be things like you'd be doing with your family physician, and that'd be, screening your blood pressure, maybe putting you on a statin or things like that to prevent that. And then primary medicine is prevention in the first place. So that's more in the public health space. So that's if we subsidize fruits and vegetables and people ate an average, an additional one serving per day, would that have prevented the heart attack from happening in the first place? Primary healthcare goes into the prevention piece, and that includes not just nutrition, but also physical activity and social connections. So that comes into the things about making more walkable cities, making fruits and vegetables more accessible, subsidizing grocery stores in low income areas. And then also the the mental health piece, right? Like we really learned during COVID how important that mental health piece is, right?
Right. Absolutely.
So that's primary medicine. Primary medicine, a lot of people kind of think public health, because that's, the two are very similar, but that's thinking about health on a population level. Secondary is more screening, and then tertiary is individual nutrition. So what got me excited about primary medicine is that that's exactly where supplements come into play, right? If you're having a heart attack, no supplement's going to help you.
Right.
But could certain supplements, magnesium, coenzyme Q10, fish oil, could that have, maybe negated or prevented the heart attack if you were proactive 20 years before? Potentially, right? So that's kind of like what gets me excited about supplements. And that's also where I feel like supplements have a bad rap, is that a lot of people are thinking about supplements in a tertiary healthcare setting, right? If you're having a heart attack, of course a supplement's not going to help you, right? But could a supplement have helped you? Could a supplement have prevented you from getting that heart attack? Potentially, right? I'm just throwing the heart attack example out over and over and
Right.
over, but we
Right.
can also talk about type 2 diabetes, cardiovascular disease, right? And that's where I feel like supplements are really misunderstood, is that supplements aren't going to cause an immediate result. They're going to help fix some of the issues that are actually causing the symptoms and the disease itself.
Almost like it's you're taking it as a preventative to help your body kind of detox or detour, or whatever the word is you want to use it, and supplement what you're not getting nutritionally, is what I'm hearing you say.
In a sense, yeah, yeah. But then supplements also play a role into like general health, right? Like, maybe you're trying to optimize strength or optimize brain function or things like that. But yeah, supplements definitely have a good role in the primary healthcare setting. But yeah, so that's kind of like what got me to do my PhD. And that's kind of where our research was about, is that what we did, which was different about our research, is we recently relocated people. So with humans, there's a big, what would the word be? Habitual component to humans. Like humans are generally habits of creature, right?
Habits.
So
Yep.
especially older adults, if you take an older adult who's been living in the same place for 30 years, you really don't know how much of that was their environment or how much of that was just their habits, right? But if you move them to a new location, you get a better understanding of how the environment affects their dietary habits because they're in a brand new environment, right? And then the other cool thing about that is you can study their environment before and after, and then you can get better inferences on the change of the environment and how that changed their dietary habits. This was called a quasi-experimental study. So a quasi-experimental study is when you look at the same person in two different environments. So that's what was interesting about our study. And what we really tried to do is look at the environment, and then we use a theoretical model to understand how the environment affects brain function, which affects dietary habits. So we use the COM-B model. Have you ever heard of that?
I've never heard of that. Actually, I was going to ask you what that means.
So the COM-B model is a very famous theoretical model, which basically states that the all behaviors are influenced by your capability or opportunity and your motivation. And it's not if all three of those elements are in sync that the behavior will change. So let's take fruits and vegetables, for example, right? Having the motivation to eat fruits and vegetables is important, but you also need the opportunity, right? So that's kind of like what I felt cheated about in my master's degree is like, I could learn all the health benefits of broccoli, right? We
All of
could,
it.
learn everything. But if I couldn't actually eat that broccoli, that's not doing me a whole lot of good, right? So you
So
have,
go ahead. I was going to set up the platform as like what you're saying is you took these groups of people and in their environments, which is where they're living, what food is available. And you're saying if I'm in a neighborhood and broccoli is good in nutrition, but I don't have it available, there's a lack of motivation to eat it, correct?
a lack of well, not necessarily. There could be a lack of motivation. There'd probably be more of a lack of capability,
Okay.
but all three are intertwined, right? Because
Mm-hmm.
you could be highly motivated to eat broccoli, but after you go to the grocery store 50 times and it's never there, your motivation will start to decrease, right? So what's interesting is like the reason why this model is so famous is that your capability, your opportunity, your motivation, all three of them are intertwined in themselves, right? Because it's one of those things like the more capability you have, probably the more motivated you are. The more opportunities you have, the more motivated you are, right? Like they don't act independently. And if you think about any behavior, whether good behavior or bad behavior, all three play a role, right? Like you could even think about robbing a bank, right?
Yeah.
Most people probably have, maybe not high motivation, but like there's the motivation there because they think about all those millions of dollars. They probably don't have the capability though, or the opportunity, right? So like any behavior can be linked to its capability, opportunity, and motivation. So what we really wanted to understand is how does the environment affect people's capability, opportunity, and motivation? And then how does that actually affect their dietary habits is what we were looking at. Now, I do need to kind of throw a Pandora's box into all this is that I did my research post COVID. So that was obviously a huge, huge factor.
Well,
Um,
yeah.
yeah. So that's, again, with older adults too, is like we did all of our data collection immediately after the COVID restrictions were lifted. So even though people had recently moved, they were probably still self-isolating, especially older adults, because I know a lot of older adults still, didn't go out and didn't go to grocery stores because they were concerned. So that was kind of like the whole wrench in the plan of everything. But I
Yeah.
mean, that's any study published between 2020 and 2022, that there's COVID was a massive factor. So
What's interesting about the motivational and the opportunity and the capability is as a neurolinguistic practitioner, like I'm not a neuroscientist, but I study the habits and behaviors of people and why they act and do what they do. So as we dove into just the idea of like, all right, certain neighborhoods, right? You and I had talked about if you're in a lower income neighborhood and these foods aren't available or they're government funded, you know, how motivating is that, like you said, to the cost? You have to go to a different neighborhood to shop at a different grocery store. Like, what's the availability? And as I'm understanding your research paper is, would you say those income places make a factor, like even especially with older adults who maybe they live in a lower income and then go to a higher income because they retire or something like that?
what was really interesting about our study is we asked about the accessibility, affordability, and availability of fruits and vegetables. So we asked about
Mm-hmm.
accessibility, affordability, and availability. The accessibility was very high. The quality, so the availability was also very high. They all reported a 5 out of 5 median of quality of fruits and vegetables, ease of buying fruits and vegetables, taste of fruits and vegetables, things like that. You want to know what was the one thing that they all reported a much lower score on?
What did they?
Cost.
So cost wasn't really necessarily a factor. It's just more about what was available.
Contrary is that they found the availability was good. They found the quality was good. Cost was the concern. So basically, we asked them on a scale of 1 to 5, how would you rate this? 1 being the worst, 5 being the best. When it came to accessibility, they all rated 5. When it came to availability, which also includes, freshness, quality, they all rated a 5. When it came to cost was a 3.
That's interesting. With your findings in the neighborhood and food environment and it being determined on dietary habits and particularly for older adults, as a modifying the food environment could potentially improve dietary behaviors and reduce the risk of non-communicable diseases like obesity, diabetes, and heart disease. In your research, when you're talking about these things, how do you think this affects urban planning?
It's huge, because in a lot of low-income areas, they're called food deserts. I'm sure you know what that term is,
I
but
maybe I've never heard the term food deserts, but maybe it's like a community garden.
no. So a food desert is when no healthy foods are within walking distance.
Never heard of that.
So it's one of those like chicken or the egg things, is
Okay.
that a lot of low income areas have higher concentrations of fast food outlets and very, very little grocery stores. And grocery stores would argue that, well, it's only high income individuals that buy groceries, low income people want fast food. There is some truth to that, but also they're only going to eat fast food if only fast food's available. So if you look at low income areas of most major US cities, there's no grocery store within walking distance. There's also zoning concerns. A lot of zoning in low income areas don't support grocery stores for whatever reason. But if you look at the concentration of grocery stores in high income areas versus low income areas, there's way more grocery stores in the high income areas. So that's what's called a food desert, is that a lot of the low income areas are considered food deserts because the only food available is fast food, convenience stores, things like that.
What's interesting is how do you see technology and innovation shaping the future of these food environments and being more accessible? So in a food desert, you can hop on your app and have somebody deliver it to you. Did you
So
find
the,
that to
the,
be affecting anything?
the issue there is that I think it's going to help the people who aren't vulnerable, in that if you think about the person who would use an app, which is more expensive because you have to pay for delivery and things like that, right?
Yeah.
Those are people that probably already have a car, or in a high income area where accessibility isn't as much of a concern for them. But if you have someone in a low income area who doesn't have a car, is limited to public transit, they probably can't afford a lot of those grocery delivery services and things like that, especially in places like Canada. Our meal delivery, grocery delivery things are super expensive just because we don't have the population density. When you add up like the delivery fee and the tip and all that stuff, it's like an extra like $10 to $20, which is
Uh,
significant for someone on
That's
a
huge. That's
limited budget.
huge. That's like for some people, that's what a tank of gas for a couple of days.
Well, we always joke in Canada, like we have Skip the Dishes, DoorDash, Uber Eats, like all the same ones you guys had. But we always joke our $20 meal ends up being $40 because when you add up the delivery fee and like the DoorDash fee and like the tip and everything, like it literally doubles the price of it. Like it's crazy.
It really does. So that would be a good question to ask you is, as you do this research, is it only based on Canadian or is it US and Canadian, or how does that come together?
All of our study groups were in Alberta. So we had 9 different study sites in Alberta, and it was a mix of low, medium, and high income. So we had some subsidized housing, we had some mixed rate housing, and some market rate housing. And then we also pooled from medium urban, small urban, and large urban, which used to be called rural, suburban, and urban, but we don't use those terms anymore. Now it's small urban, medium urban, and large urban groups. I know I had to rewrite my whole that whole
The
section of my
whole
thesis because
section
I guess those terms
because it
change.
changed.
But so yeah, so that's another thing when it comes to like these apps, right? Is like someone in an urban setting, a lot of those apps don't apply, right? Like if you're a farmer in the middle of nowhere,
Well, you're not going to
DoorDash
order
isn't gonna,
food. No, you're not going to at all. So I guess
right? So
somebody reading this like me, when I'm thinking about this research, I guess, is it applicable to think that these areas are more common around the country than just in Alberta? Like when you're reading this type of research, does it get, is that like you could get a bigger perspective on it like that?
you could, I mean, you could hypothesize that, but you can't ever like take data in a place and then just automatically assume it's going to correlate to other places because, you know, there's like the seasonal component. Like obviously our seasons in Canada are very different than America.
Right.
Taxes are different in each province or state. The societal and cultural component of food is very different in each, you know, city and state, right? If you think about what's culturally acceptable to eat in Texas versus California, it's very different,
Well, and just
right?
culturally, like everything, right? You meet up for dinner, you meet up for lunch. It's like a thing to have food part of your meal. So was that considered in this study and what you were going to research is like having food be cultural?
That was a big component of it, definitely. And that really takes into account the capability, opportunity, and motivation, right? Because, you know, that cultural piece and especially that sociability piece, especially in older adults, is a big factor in that motivation piece. Because unfortunately, what happens with a lot of older adults is they get widowed or things like that, and then they lose the motivation, right? Like you often
Right.
hear an older woman basically say, like, I don't want to cook for myself. And then what do they end up eating? Toast and jam or
Yeah,
things like that,
processed food,
right?
because that drive for a woman, I don't know how it is for men because I'm not a man, but
Yeah.
we, for the most part, we thrive on being able to cook as an act of love for our partner or spouse or whoever it may be. That's something we enjoy doing. So I can totally understand that for a woman, if there's no one to cook for, you know, like if I was a grandma, my grandkids come over or something, but that's a good point.
That's what I liked about my research, and that's what I hope more research in this space comes out, is that when we think about food, there's a lot more to food than just calories and micronutrients,
Right.
right? Obviously, the macronutrient profile, the micronutrient profile, those are all very important, but there's a lot more for food than just that. If you think about most holidays, there's a food component. Christmas, Easter, Thanksgiving, birthdays. If you think about most emotional memories, there's a food component, right? Like most people have memories of meals their mom made, or, you know, and that's, you know, where that whole like comfort food thing comes in, where like when you're sad, you want like foods you grew up in, right? Like there's so much more to food than just the food itself. And that's why we really need more research understanding, you know, some of these theoretical processes behind food, like the capability, opportunity, motivation, just to better understand how does the environment, which includes not just the physical environment, but also your social environment, how does that affect our desires for certain foods? Right. And then not just that, also your upbringing, right? There's a huge societal component of food is that I love to cook because I grew up with parents who cooked, right?
Your
Had I
traditions in the home. Hmm.
had I not grown up with parents who cooked, I probably wouldn't cook, right? And I have a lot of friends my age who don't cook, and usually that's the case is that their parents never cooked, so they never cooked, and they just, you know, they just. So that's kind of like what gets me excited about this research, and that's kind of what also I hope we get more research on in like children, because both children and older adults are vulnerable populations in different ways. So
What's interesting is you said it relates back to childhood is, you know, your brain development between the ages of 1 to 12. I don't know if you how familiar you are with this. Everything subconsciously is programmed, right? Your behaviors, your patterns, everything for the most part before that kind of closes down. And then those things are carried into your adulthood. So what makes this food component about what you're talking about so interesting to me is I grew up in an environment where I had healthy parents that cooked and it was a family thing. But as I got older, I had a very emotional attachment to food in a way. You know, being told, oh, you're big boned, or you and I being familiar in the bodybuilding space have an understanding that we have control to change our body, to change our environment. and to apply the self motivation to eat the food. So it's really interesting how you have taken something I have been thinking about over the last year, like how do you create a motivation to change your food habits? Where does that come from? And then studying the brain behind it and kind of just observing our conversation of how these things come together is quite interesting, because how many people address their dietary habits when they have, like you said, if they're going to have a heart attack, or maybe an income change happens and they have to eat different foods based off of lower or higher income. And, as I got older and became more self-aware with these emotions that I was having by addressing them, it was almost like I had reflect back from my childhood where they came from. And so it makes me excited that you have started to touch and open up this research, because this could really open up a lot more for people in the awareness of just what they bring into their environment. Don't you think?
The other thing that was very interesting is that with the whole relocation piece, we asked people why they moved, right? And that also understands what people care about in their environment. We asked,
Mm,
was it, nearby accessibility to transit stops? Was it nearby accessibility to essential amenities? Was it closeness to family and friends? Was it safety? Was it, we asked there's more questions I get into the podcast. You're welcome to share the thesis, but that also helps us understand, why do people want to live in certain places, right? And especially
right.
with like vulnerable populations who don't have a car or have limited mobility, that helps with urban planning to understand, what are they looking for, right? My hypothesis, and it was actually, supported in my research, is that a lot of older adults care about the walkability to essential stores, transit stops, things like that, because a lot of them don't have cars or aren't comfortable driving. Like, I know my grandpa still has his license. He doesn't like to drive because, he just doesn't really feel comfortable. He'd much rather walk somewhere, things like that, right? So that really helps urban planning, because we kind of got to be thinking about, when we're designing old folks' homes, where are we putting them, right? Like, a lot of the old folks' homes, I know that's technically not the politically correct term, but whatever. When I was doing my data collection, I would drive into the middle of nowhere. And it'd be a beautiful building, right? There'd be like tons of grass and parks and everything nearby. It'd be like, the closest grocery store is a 20-minute drive. Like, this makes no sense for an old person. Like, it's way out of the way. Nothing is nearby. Like, you can't walk to the post office, the grocery store, anything. Like, you're almost isolating them as if they're in prison. Now, I know that's like a pretty extreme analogy, but like, that's what was going through my mind, is like, this is so inconvenient for them. But it's one of those things where, like, just because that's how the zoning is, that's where it was put, right? So I'm hoping this kind of research kind of makes us think a little bit more critically on some of our vulnerable populations, and also making things more walkable and more accessible, right? Because in a perfect world, everyone would just know nutrition's important, and then, take the necessary steps, whether it's an Uber or a cab or a bus station. But for a lot of people, if it's not convenient, they're not going to do it.
Right. Agreed.
Because what's the number one New Year's resolution?
Weight loss, and to start
Eat,
doing it.
eat, eat
Eat
better,
better.
start
Yeah.
exercising, quit smoking. Why
Change
do
your
people not,
habit.
why do people not stick to it? It's not easy, right? Like, we want something that's sustainable, right? And like,
Convenient.
I always remember, in January, you'd have like the New Year's resolution gym goers who would be there twice a day, working out 3 hours each time, like, and I'm like, hey, like, kudos to you, but they wouldn't stick to it because that's not sustainable,
No.
right? And if it takes you 20 minutes each time to drive to the grocery store, and it's like a total pain in the butt, you're not going to keep doing it.
No, it definitely has to be in a where you can. So the goal is you're hoping that the research opens up to better urban planning. And with that being said, was there anything during the research of this, and especially 14 years into it, that you questioned what you were getting into?
Um,
Like you were just like, should I even be studying this?
Nutrition's a tough topic because we can't agree on anything, right? Like, like, some people think sugar's the enemy, whereas, like, other people think in moderation, sugar's fine. Especially when it comes to like artificial sweeteners and things like that. You have like very, very polar views where some people think it's fine and then other people think, it's, the devil and things like that. I kind of have a more modest approach. I think everything in moderation is fine. I don't think sugar is good for you. I think a small amount of sugar is probably not going to hurt you. I don't think artificial sweeteners are good for you, but I don't think a small amount is going to hurt you. But there's very conflicting views in nutrition. And same with medicine. There's very conflicting views in medicine. And that was the hardest part about these 2 degrees, whereas in engineering, you're right or you're wrong, right? Like
Right.
calculus, there's no gray area. It's you did the proof correct, or you did it wrong. Whereas nutrition and medicine, you're never right, you're never wrong.
Because
It's
it's
about
based off of the person you're working with, is what it sounds like, really.
so a great example would be me and a kinesiologist going to an urban planner and me saying, we need to pave sidewalks to grocery stores so older adults can walk there. And the kinesiologist would say, we need to develop a park within walking distance so that they can, easily walk in and be more mobile and things like that. We're both right. I think nutrition is more important. He thinks physical activity is more important. And then we both have to make our argument of why we think we're ours is more important, right? Neither of us are wrong. Neither of us both think we're right, but no one's really right. It's one of those things where it's all about justifying your rationale. So yeah, it's one of those things where it's like nutrition, you're never right, you're never wrong. In medicine, you're never right, you're never wrong. And like in the tertiary medicine case, you go to 3 surgeons, you get 3 different opinions.
Yeah, you would, wouldn't you? But what I would be curious to understand is the different levels of nutrition that you have been experiencing throughout the time in college. Did each section of time from your master's to your PhD give you a deeper understanding of the food itself that gave you an understanding to me maybe why there's so many opinions and variabilities when it comes to food?
What I really found interesting, and I just as I've kind of like grown in my nutrition journey, protein is important. We all know protein is important, but really understanding the importance of fruits and vegetables. It seems like fruits and vegetables lately have gotten a bad rap, especially with this whole what is it, carnivore diet or things like that.
Yeah,
But if you look at the literature on association of 5 year, 10 year, 20 year mortality in fruits and vegetable intake, it's the amount of evidence on the benefits of fruits and vegetables is just extreme. Like just how much it prevents healthcare costs, how much it keeps you healthy. When you think about fruits and vegetables, what are they? It's a lot of water, which we all need. It's a lot of fiber, which we all need. It's a lot of vitamins and minerals, which we all need, and it's very low calorie, right? I think a lot of people kind of underestimate the health of fruits and vegetables. And the other thing that I really learned was the importance of protein, really. Just how important protein is. And you would think we would all recognize that because protein is what we are. But I feel like we're only really starting to catch on just how important protein is. So I feel like more and more nutrition literacy is going to come out on the importance of protein in fruits and vegetables. And then when it comes to things like carbohydrates and fats and things like that, that's all energy, right? Like that's just, energy sources, which are equally important. But you think of the foundations, it's protein and micronutrients, which is protein and fruits and vegetables.
this research with the rising costs of healthcare and diabetes and all the diseases, you feel like by put there being more attention in what you have studied and that research developing, this would eventually help lower those healthcare costs?
By 2050, how many people? Let me rephrase this question. I'll just give you the answer. By
Yeah.
2050, 1 in 5 people are going to be a senior citizen. And when I say senior citizen, I mean 65 plus, like the
Okay.
definition.
Okay.
By 2050, we'll have more seniors than adolescents. So there'll be more seniors than kids. If we don't start taking a more proactive approach to healthcare, especially in older adults, we're going to, like, our healthcare system is going to, we won't be able to survive, right? Just think about 1 in 5 people if they all needed individualized healthcare,
Right.
right? There's not enough doctors and nurses and LPNs and like And that's what I was really trying to get apart in this research is that if we make it so older adults can take care of themselves easily with,
Right.
nutrition, walking, things like that, that'll prevent healthcare money later on. It's kind of like you pay the money now and you really get the dividends later on. And these
Right.
aren't major things. These are paving walkways to grocery stores, right? Rezoning old folks' homes into areas where grocery stores are within walking distance, right? Even something as simple like a bus once a week that takes them to a farmer's market or things like that, right? Like
Right.
these are not huge expenditures, but the health savings is it could be astronomical, right? When you factor in things like that.
Probably just the simplest things. I agree. Um, you said something that was really quite interesting too. You've got the foods that are protein, carbs, and fats that are energy, and then you've got your supplements that kind of fill this in. And we had kind of talked about this, and I'm curious to get your feedback. I'm hearing more and more about like the ketones starting to come back, but not within the diet of that, but more of like supplementing that in as part of like a balanced play. Do you guys talk about that when you are in any of the research? Like, does any of that kind of stuff come up when food comes up, or like your body production of any type of how the energy is used in your body?
The medical and dietetic society are just starting to even grasp supplements at this point.
Okay.
Health Canada did just recently recommend vitamin D supplements for all Canadians. So that's huge. The fact
Okay.
that they're actually acknowledging supplementation and actually recommending supplementation, but it's still very, very minimal at this place. Like a lot of doctors make the argument with a perfect diet, you don't need supplements. And I don't necessarily disagree with them, but the follow up question would be how many of your patients have a perfect diet? I'd
Um,
say 0%, maybe 1%,
Zero.
right?
Yeah.
I have a doctorate in medicine, a master's in nutrition. My diet's not perfect, right? Like it's one of those things like no one's perfect, right? And that's where supplements and, like making healthy food more accessible comes into play is like no matter where you are in your life, we're all busy, right? And that's where, trying to make these things easier is important because in a perfect world, you don't need supplements, but I know we're not living in a perfect world. No one I know has a perfect diet. I'm sure, right? Like it's
Right.
right. And that's really where the supplementation and also the whole accessibility thing comes into and planning in advance, like having like pre-made meals frozen and things like that. And, having like a protein shake or things like that, where, in between meals, you're on the go or you're on a rush or things like that. Like that's really where, these things can have value. But there's very, very little talk about supplements and most people won't even acknowledge the conversation.
It sounds like your life calling since you were 18 and your passion has been around understanding something that's a huge part of how the human evolves around, and that's food in general, right? Your curiosity that led you into supplements and what you're doing currently, I feel like that has supported you throughout, is what I'm hearing you say, is supported through and fed your passion. So would you say this information that you've learned has also helped you to create better supplements, understanding that that's kind of what you do with what you do with your company, right? Is you create some of these supplements.
You know what it's really taught me how to do is read studies.
Oh,
Really taught me how to read studies because here's a perfect example is
okay.
that if you have data that's not normally distributed, you're not supposed to report averages and means. So here's a good example is that let's say you give 10 people a meal you cooked, right? And nine of them give it a 10 out of 10 and one person gives it a zero. The median would be 10, but the average would be skewed because of that one outlier. So if your data is not normally distributed, you don't report averages, you report medians.
Right.
And I see people make that mistake all the time, or they're using the wrong statistical method for data that's not normally distributed, or they're making causal claims from cross-sectional data where cross-sectional data provides associations, not causal claims. Like it's really taught me how to read papers and like decipher the good research from the bad research. And I shouldn't say bad research because any research is, benefiting the scientific community, but maybe like a higher quality paper versus a lower quality paper. And then also looking into power calculations and effect sizes and things like that, because a lot of the studies I've seen have very, very low sample size, which could just be chance, right? Like if two people take a product and they see benefits, that doesn't necessarily mean the product itself caused those benefits. It could have just been chance. So when you do a power calculation, that determines the amount of people you need for statistical relevancy. So you can statistically determine that this was due to the treatment or supplement or whatever thing you're studying and not just by chance. Whereas a lot of studies aren't doing power calculations. So it really taught me how to understand research and also perform research. And in terms of formulating supplements, it really helps me kind of decipher which ingredients have good clinical evidence versus which ingredients don't. And I should say again, just because an ingredient doesn't have clinical evidence, that doesn't necessarily mean the ingredient doesn't work. That just means the evidence isn't there. Whereas something like creatine, we know it works, right? Like there's enough
Right.
studies to
Right.
validate it. Whereas a lot of these new study and a lot of these new ingredients that everyone talks about, I'll be of the opinion, I think this is exciting, but there was one study done on rodents. I think, this is something to keep your eye out, but I'm not necessarily sold on this yet when there was just one study in rodents, right? Like, what does that
Right.
really tell us? Right. So that's what it really did is it really taught me how to read studies and also public speaking. It really helped me with is answering questions, public speaking, and also how to not jump to conclusions, right? Because we're all very determined people, but there's very different ways you can look at things, right? And that's kind of like what the whole medicine doctorate taught me is that I'm passionate about nutrition. I think nutrition is the end all be all. A kinesiologist would say that movement is the end all be all. Someone in public health would say social connections and mental health is the end all be all, right? No one's right, no one's wrong, right? So it's kind of to have more of like a broad view to all these topics because usually there's never just one right answer.
All within perspective.
All within perspective, yeah. But what it does get me excited about is seeing all the new scientific literature coming out on supplements. Because really in the last 10 years, the amount of papers that have come out on herbal extracts, nutraceuticals, it's growing. And I think it's, an area where science just continue to evolve more and more and more.
I would agree with that. And then, like you said, having clinical data that you can actually read and then validating it in a certain way. And I think you said something key there too. Most people put out a clinical study or clinical data, but they don't actually, people might not understand how to actually interpret that. So they just take the frame, oh, there's a clinical study behind it, so it must be good. So I bet that was pretty empowering to now be able to understand it to your ingredient level at a greater
You know what's
depth.
even crazier? I won't name names, but there's clinical studies showing the supplement had a negative effect, but they still publish it. So people think just because there's a study out there, the supplement, it's good.
Oh, that's
There's actually been
interesting.
studies where the supplement was worse than the
It was
placebo, but they still publish it,
to say
and
there
they're
was a
just like
study.
to say there was a clinical study. And I actually remember having a conversation with the sales rep. They were trying to sell me the ingredient, and I was like, "Yeah, send me the study. Absolutely, I'd love to read it." And I read the study, and I'm like, "Do you realize that supplement didn't work and was actually worse than the placebo?" And the sales rep was like, "No." I'm like, "You guys should probably read your study before you're sending it off to people."
I did before I sent mine to you. Just to
But
tease you and
but
just to tease you.
but hey, like honestly, like
Yeah.
that said, like I give them kudos for actually performing data.
Yeah.
And just because you get a bad result, that then allows you to reformulate, right? Then you can hypothesize, okay, maybe what didn't go right here, and you can reformulate, restudy, right? Like there's no such thing as a bad study. So like any company doing clinicals, I encourage them because they're trying to get evidence-based results. But, also read your studies before you start sending them out to people.
You know what? Thank you so much for sharing all of your work for the last 14 years and your passion behind what you do and who you are, where do you see yourself going from here?
That's a good question. I only finished my doctorate 3 weeks ago, so I'm still trying to think about it. One idea I've had, which interests me but also terrifies me just because I know the amount of work involved, is that to potentially come out with a podcast that's only on supplements.
Oh, that would be good. I've not heard
So,
of one yet.
well, we all know Andrew Huberman, right? And his
Yeah.
podcast is fantastic, but
Hmm.
it's kind of all over the place. Like it'll be a podcast on supplements and a podcast on like physical activity. I think if there was a podcast where every episode was a supplement and it just summarized what the supplement is, what does the clinical evidence say, and then, in layman's terms, what would a dosage for a male versus the female, dosage for an athlete versus a sedentary individual, right? Like, I think something like that would be really interesting.
That would be really
But
good.
saying that, and you would know this, hosting a podcast, the amount of work that is involved with like putting together the scripts and then
You know what,
editing and
though?
then
You would be really good at it because you have now done 14 years of work. You know how to read the studies. All you would have to do, honestly, is pull up a supplement that you're familiar with. You know all the things in your head. And like literally, you could put it all together and talk about it. You are so well spoken.
well, the other thing that would really interest me is that I remember being, 18 at the supplement store and like, you don't know what works, right? You're
No, you
like,
totally don't.
everything looks shiny. So it'd be
Mhm.
really cool if every supplement had like a rating. So like based on the clinical evidence, what is the rating? So like creatine would get a 10 out of 10 and then like whey protein would get a 10 out of 10. And then something that's less studied would maybe get like a 6 out of 10, right? And that
Yep.
doesn't mean the 6 out of 10 is worse. It just means if you only have a certain amount of money to spend, these are the supplements that are the most validated by science, the most bang for your buck, so to speak, right? I think that'd be really cool is if, like in each podcast episode, then you rated the supplement.
That would be really cool.
I'm just
Well,
thinking about this all,
maybe you
but,
should write
I
it
think that'd
down
be
and then think about what that looks like for you because you never know. You might be the guy.
maybe.
Yep.
I also don't know if I want to be the guy because I know how much work that would be. Because if you think about how many supplements are out there, that's a lot of episodes.
It is a lot of episodes. Well, thank you for being on with me today.
No, thank you, Bonnie. Thank you for the opportunity.
Thank you for listening to today's episode. If you like what you heard, please share it and help us keep the conversation going.